An ultrasound examination of the breast does not give a diagnosis. Is this shocking? Surprising? In this video, I will explain how this happens, especially in relation to Norazilla's story. We'll listen to her story, then continue with the discussion.
Hello, I'm Norazilla, or Ra for short. I'd like to share with you my breast cancer journey and hope it will inspire and empower you to make treatment decisions that will benefit you. I was fortunate to be able to participate in a mammographic screening program at a private facility and attended screening sessions soon after I turned 40. Being a busy professional, I was not always punctual in these screening sessions and had a mammogram with an ultrasound examination of the breast the year I turned 50, about 3 years after my prior examination. It was reported that I had a new finding detected in my left breast on the ultrasound examination. This finding was not, however, detected on my mammogram, which was done on the same day. My doctor discussed the implications of the new finding with me. Because the likelihood of it being cancer was low, at 0.2%, she recommended follow-up in a few months' time. In consideration of my prolonged trip to New Zealand soon after, it was thought that a review in about 9 months with a repeat ultrasound examination would be appropriate. She also went through my options with me, and at the end of the consultation, I decided that I would have a biopsy done so that I could be certain that I did not have cancer before my extended trip to New Zealand. The procedure that I underwent was a vacuum-assisted breast biopsy. Since the ultrasound nodule could not be felt on physical examination, it had to be done under ultrasound guidance. The nodule was completely removed at the end of the procedure, and if it were found to be benign on pathology examination, I would have complete peace of mind that the lesion was no longer present in my breast. However, the pathology report of the tissue that was removed from my breast turned out to be invasive ductal carcinoma, which is the medical term for breast cancer. It was fortunate for me that I had made the decision for a biopsy, enabling my cancer to be detected at an early stage. I delayed my trip to New Zealand in order to complete my treatment, and I am glad to say all went well. As a recap, the odds that the new finding in my breast was cancer was low, and my doctor estimated it to be 0.2%. This means that of 1,000 women who had similar findings within the breast, only 2 will have cancer. All the others will have benign changes. The reason why my doctor recommended follow-up was because the risk of having a complication during the procedure was the same as the risk of me having cancer. However, I was willing to accept the risk of a complication for peace of mind because of my circumstances. So discuss your options with your doctor. While I understand that we may choose differently, I hope this helps those who encounter similar circumstances as mine. The medical aspects of my case will be discussed soon in another video section. Stay tuned.
Thank you for staying and watching up to this point in the video. We will now move on to discuss how ultrasound findings are assessed. This information is for education purposes only and is not intended as a substitute for a medical consult, so may I encourage you to see a doctor if you have specific issues. This is a textbook description of what a benign lesion is expected to look like on ultrasound examination. It should have an oval shape, sometimes referred to as elliptical or ellipsoid, wider than tall, have a thin, smooth outline without any irregular appearance noted. The author of this chapter has indicated a diagnosis. It is denoted as a fibroadenoma, which is benign breast tissue change. Now here is the challenge. A diagnosis, even for benign conditions, cannot be made with certainty unless breast tissue that has created the ultrasound image has been removed and sent for pathology examination. The process of removing tissue is known as a biopsy, and there are several ways to achieve this depending on the specific clinical circumstances. It is best to consult your doctor about it. It is only after examining the appearance of the tissue arrangement under the microscope that we would be able to know if the breast tissue is normal or is invasive breast cancer. So what information does the ultrasound provide? It actually helps us understand the likelihood or the risk that an ultrasound finding is cancer. This likelihood is sometimes referred to as positive predictive value. You will recall that Ra's ultrasound report indicated that she had a probably benign finding, also referred to as BIRADS Category 3. BIRADS is short for Breast Imaging Reporting and Data System, and for findings which are assessed to be probably benign, or BIRADS 3, the likelihood that the finding would be cancer ranges anywhere from 3%, as was evaluated by this group of doctors, to 0.2%. Here it was found that of 605 lesions assessed to be benign or probably benign, one lesion was diagnosed to be cancer. As Ra mentioned, a biopsy does carry a small complication risk. So in the balance of probabilities, when a finding is detected on ultrasound and assessed to be probably benign, doctors would usually recommend monitoring the behavior of the lesion, then removing it. Ra decided to undergo a biopsy due to her special circumstances, but she understood that in as high as 99.8% of cases, it would not be necessary. If this has helped you understand findings on breast ultrasound better, please like, comment, and subscribe. See you in the next video.